Vaginal tightening or spasm can happen to any lady depending on so many factors. This is medically called vaginismus. Vaginismus is a condition where there is an involuntary tightening or spasm of the vaginal muscles, causing penetration or painful or even sexual intercourse impossible. This can happen to any lady, this can happen to any woman at all. It's not age limited. Most often, this tightening is not something you can control. This tightening is not something you can voluntarily say, okay, I want to stop tightening my vagina. I want to stop it from, getting too tight. I want to stop this spasm that is happening. Most often is autonomic. So what exactly can cause this vaginismus, this tightening of the vagina? Some of them include anxiety or fear. And another is emotional factors. This is not about anxiety. This has to do with emotional stress. Can also be medical conditions like infections, sexually transmitted infections, UTIs, hormonal imbalances, and even menopause. Yes, menopause. And there are some cultural or religious teachings that makes one feel bad having sex. What are the signs and symptoms that actually depicts a woman having vaginismus? One is painful penetration. Ideally, sexual intercourse should be fun. It should be pleasurable. It's not something that should cause pain, right? So when you begin to have that consistent pain, you may have to check, is my vaginal muscles tightening? Is there tension around that area? There is also inability to insert tampon. Once there is something going in, the muscle on its own, they just click. Something is coming up and they begin to tighten. And most often there is this sign of avoidance of sexual intercourse. Once he starts any sexual act, you feel this fear, the anxiety just comes up, and you do not just know how it comes, but it's just there because the fear of the pain you've experienced before is still there, and you don't want to experience that pain again. So there is this pain that comes with you not having anything to do with sex. So the help or the treatment or the management ranges from sexual education. Proper sexual education goes a long way to combat this. And your healthcare provider can encourage you to do pelvic floor therapy, yes, through the guidance of a physiotherapist. And then psychotherapy. This is very important. And in some cases where it has to do with an underlying medical conditions, please go see your doctor, go see your healthcare provider to get these things treated. Because for the fact they keep enduring in your body, vaginismus will also keep enduring. Yeah. So yes, vaginismus is treatable, it is manageable, but first you have to seek what? Help. I hope you got value watching this video. And until next time, bye.